For many women, enlarged breasts cause a lot of discomfort by them having neck pain, back pain, inframammary itching, that is below the breast crease. They develop itchiness due to sweat accumulation, and especially in summer months it becomes quite challenging for them to keep it dry and not be troubled with it. Also, enlarged breasts cause them to be a focus of attention, unwanted area of attention, and some women, some young girls feel quite inhibited in carrying on their sports activities. So their social interactions or social ability to play sport are inhibited, and they do not know that this can be corrected. So a reduction surgery aims to reduce the volume of the breast, give them an appropriate breast with good form, and enhances their confidence to carry on such activities such as sports, and gain confidence in interpersonal relationships and socially being functional. The size of a breast for any women, appropriate size gives the confidence and gives them the ability to be socially functional, wear appropriate dresses, and have a good interpersonal relationship. A smaller breast also is a cause of concern. An asymmetric breast is also a cause of concern. When I say asymmetric breast, one breast is larger than the other breast. Usually 10 to 20% discrepancy in the size is acceptable to the women, but more than that it becomes quite obvious. Choosing an inner garment which is not of the appropriate size, because the sizes are different, also makes them find difficult to find the appropriate clothes, and be very conscious when they wear certain kinds of thin, huggy dresses that they wear. An improvement in the size of the breast is also sought after by young women who feel that they are not well endowed, and that is a cause of their concern socially, and also being a point of ridicule in peer groups. A reduced breast or absence of breast tissue can be congenital, or during growth periods, adequate growth of the breast is not there. So these can be corrected by different means, and by means of implants, an enhanced breast volume can be achieved. By means of fat filling, that means from an area of having more fat, liposuction. By means of liposuction, fat can be taken out and then injected into the breast at appropriate areas to give it good form and size that the woman desires. The only downside of this is that the breast volume can reduce over a period of time up to 1 year. 30% of what you have put might go off, but the woman definitely will have a larger breast than where she started with, but not exactly the same size of breast that she saw in the immediate post-operative period, and this will reduce by about approximately 30% at close to an end of 1 year. An implant, however, gives them an adequate breast size, which they can try the sizes prior to the surgery and see that what size of the implant is they are happy with. And that implant, when it is placed, obviously it does not go down in size, and patients are happy. Some patients have a concern that it's a foreign body and does it produce any complications. Normally silicone material, it produces sometimes a capsule, that means a covering around that. Apart from that, there are in the immediate post-operative periods of bleeding or fluid collections which can happen. In good hands, usually it doesn't happen. However, a capsular contracture can happen, though it is very rare in women. Some women also feel that an implant needs to be changed, and because they read about certain myths of it needing to be changed. However, it does not need to be changed unless it causes any problems like a capsular contracture, wherein from externally when you look at the breast, if there is a contracture of the capsule, which is a sheath around the breast which is formed by body's own tissue, then that area might look a little bit grooved, or it might not look fully round. So in such conditions, the implant needs to be changed, not otherwise. Earlier they were thinking that 10 years the breast implants need to be changed. I've seen women who've had it for 30 years and had no issues. So corrective measures to take to correct in a breast asymmetry or smaller breasts are implants, lipofilling, and in some individuals, and if there is an asymmetric breast, one large breast and another small, and there's a discrepancy of 50% or more, sometimes you can reduce the larger breast and put in an implant into the smaller breast, or put some fat into the smaller breast. For the different methods of correcting an asymmetry or smaller breast or ptosis of the breast. When I say ptosis of the breast is drooping, you want to excise the extra skin and provide a good form. So not only size change, we can correct form changes and make them more appropriately aesthetically looking breasts. for women who seek such surgeries. Whichever surgery it is, either it is breast reduction, breast enhancement, or any form correction or ptosis of the breast which needs to be corrected, my aim is to give the patient the best possible advice and outcome during and post surgery. Taking the patient into confidence, I explain the procedure in detail and also post-operative outcomes and scar management techniques to minimize the breast scars, because some women have a concern about those areas, and post-operatively 1 year later, if the surgery telltale signs are not there, they are happier patients. So the outcome measures are all in my mind, and then I have a shared plan with the patients and strive to achieve a result which is satisfactory to them and to me.